pleasure to be one of the organizers of the conference, and we hope that you find this panel helpful to you. So next, I'll turn it over to Sanjay Saxena. Dr. Saxena?
Hi, my name is Sanjay Saxena, and I'm a psychiatrist at Rogers Behavioral Health in San Diego, and also clinical professor of psychiatry at UC San Diego. Been doing hoarding-focused clinical work and research for also too many years that I want to admit, and I'd be happy to answer questions today.
Great, thank you. And next to Dr. Robin Zazio. Robin?
Good morning. I'm having some audio trouble, so I'm going to talk a little strangely slowly so that hopefully everybody can understand me okay. I'm Robin Zazio. I'm a licensed clinical psychologist. I am the owner and director of the Anxiety Treatment Center in Sacramento. I've been specializing in treating anxiety disorders for about 22 years now, and more specifically with hoarding behaviors for about the last 15 years, and I'm delighted to be here.
Thank you, Robin. And next to Dr. Chiara Timpano.
Good morning, everyone. I'm joining from Miami, Florida, where I work at the University of Miami, and I have been involved with hoarding research for many, many years now, and delighted to be here at IOCDF.
Great, thanks, Chiara. And now to Ross Bartleman. Ross?
Hi there. Excuse me. I'm basically here as a person who has lived experience with hoarding, probably starting back in, I would say, the early 90s, and probably would consider myself to be a recovering hoarder at the moment. So whatever that means.
Okay. Thank you, Ross. So our first question goes, I think, to Dr. Saxena. This person would like more information, at least the information that was presented in the movie, about brain areas or deficits that seem to be related to hoarding disorder. Do you want to comment?
Sure. This is an area of ongoing research over a long period of time. What I was highlighting in the film when it was viewed was some of our research into functional brain abnormalities in hoarding disorder. The findings have been, somewhat varied, but I guess if there's a consensus or some convergence of the data onto particular brain systems and brain areas, one of those would be an area of the brain called the cingulate gyrus. It runs on the center of the brain, and both the anterior or more forward parts of the cingulate gyrus, as well as the middle and posterior ones, appear to have lower than normal brain activity in people with hoarding disorder. And in fact, in one of our studies, there was a correlation between the amount of activity in that area and the severity of hoarding symptoms. That is, people with the most severe hoarding symptoms had the lowest activity in the anterior cingulate cortex. And so this is an area of the brain that's involved in a number of different things. It's involved in focused attention, it's involved in decision-making, it's involved in the ability to regulate or inhibit emotion. It's involved in the ability to choose amongst multiple conflicting options. And I think some of those functions that it has as part of networks with other brain areas are ones that we can think of as most likely related to the types of difficulties that people with hoarding disorder have in decision making, in choosing amongst multiple options, in regulating emotion.
Thank you. That's very helpful. So from Lynn comes a question about how important is the background activity of hostility or tension in her mind? And so let me direct that perhaps to Robin or Chiara. Hostility and tension.
I'm not sure I understood the question clearly. What was, I don't have the Q&A up, Gail,
yeah,
but, how important?
Kiara, do you want to take a stab at it?
Yeah, I mean, I think that maybe I think that maybe what the person, I'm going to take a gander at what they were trying to kind of get at, because as Robin, I'm also not quite sure what the direction was. But I think about a lot of my patients. They'll talk about the fact that they almost feel like they're of two minds, where on one hand they really like their objects. They really, have this strong attachment. These are their treasures. And then on the other hand, there's this awareness that I shouldn't have all of these things. I shouldn't be collecting in this manner. And so there's this constant tension and war. And I think that is something that we spend a lot of time in treatment, trying to kind of balance those two sides of the issue. So I don't know if that is where the person was going with that question, but
that's fine. Let's go with that. And another question comes up about the relationship between hoarding and obesity. Perhaps Robin, you want to comment on that one?
Yeah, this is just a little bit of a theory based on experience. But what we seem to find is that the more that the home gets cluttered, there's less activity. And so the less activity, obviously, the less exercise a person is getting and mobility. I think one of the other things that I've seen is that as the areas become more and more unusable, i.e. the kitchen area, that there's less of home cooking and things like that. So people are tending to go out. There might be more fast food and things like that. So nutrition can kind of sometimes get pushed to the side. And I think that can contribute not just to the mobility within the home environment, but also increased weight gain.
It's also possible, if I can add a comment, it's a little bit of a chicken and egg. We don't really know whether the two come from the same source, whether one precedes the other or vice versa. For someone who is perhaps already prone in early life to weight gain, perhaps that discourages people from doing things in their home, that kind of just what Robin was saying, but slightly reversed. Or whether or not there's something about eating and collecting things that stems from the same source of a need that's not met in quite the right way. But it's an open question that I don't think we understand fully at this point. Ross, I'm going to ask you, does participation in some type of support group lead to a higher probability of improvement for those with hoarding? And others can chime in after you comment on that.
In my case, I would say yes. I was fortunate enough I know there aren't a lot of resources for hoarders in terms of a wide, availability of support groups in some cases, and perhaps resources in order to hire professional organizers, those kinds of things, or psychologists. But I was fortunate to be in a treatment group, so a self-help group at the University of British Columbia for a number of months, many years ago. And it definitely has helped me considerably in terms of relating to objects in a different way, even though I still struggle with hoarding. But I'm not really actively bringing as much material into the house, whether it's purchased or free or what have you. So it has mitigated that quite a bit. But I still have quite a long way to go. I'm not sort of typical paths through stacks of boxes any longer, which is great. I actually have functional areas in the home, but I still have quite a bit of stuff that hasn't been dealt with. But I would say that it's definitely helpful for sure.
Great. And I think we know from some of the yesterday, the group from Australia was reporting on the use of buried-in treasures as more than a support group, a very coordinated and planned educational program. So there's a range of support group options that people may have called different things by different groups. I'm going to move on to two questions that get at how to approach someone who has suspected hoarding problems or apparent hoarding problems, and how to approach the issue with either a friend or a family member who doesn't necessarily admit to or see the issue. So who wants to tackle that one? It's about, I think, approaching the person. Robin, you want to? Oh, Kiara was coming forward. Go for it, Kiara.
Oh, I was just going to say, we talked a little bit about this yesterday after watching the movie. And then, of course, there was also the session by Greg Chasson about taking more of a motivational approach when a loved one is struggling. And I think that, you know, there's the two sides. One is if everybody's on the same page about the problem and everybody agrees. And in that case, then family can be support, and you can work with the therapist to try to figure out how best to kind of deliver that support and how that's being received and perceived by the patient. On the flip side, we have the situation where the family members are very, very concerned and the patient is not quite there, or they don't see it to the level of concern that the family members might. In those cases, you know, we still have a lot of research to do about exactly what would be the best way to approach this. While that research is happening, the best that we can do is to really try to understand, you know, where could we find common ground between the family member and the patients. And this works really beautifully within what we refer to as a harm reduction model. Where we really want to balance the safety of the patient with their autonomy as an individual, their kind of self-determination and how they want to stay in their home and things along those lines. And so oftentimes what we find is really helpful is like, okay, if we agree that everybody wants you to be safe, how can we make that safety happen? And so you can kind of get an angle there and then work out from that. I don't know, Robin, if you want to add anything.
Yeah, and again, I hope people can hear me okay. I think one of the things that really stands out is the anger that happens in the family. They feel like they've been patient, they feel like they've been understanding, and then it gets to this level of anger and a lot of accusatory statements that then cause the individual who's struggling with the hoarding behaviors to shut down and to shut out the family members. So we all know that it is a difficult condition to treat, and it's understandable that family members who are concerned about their loved ones are feeling frustrated, especially when safety issues come up. But I think the most important thing is to try to use loving language and express how you feel about your loved one and the concerns that you have about them, rather than pointing out what they're doing, the condition of the home, how, you know, it's impacting their lives, but continuing to just express loving concern for them using kind tones and kind words.
Thanks very much. That's very helpful. Another person asks, what questions should someone who's having trouble discarding ask themselves about an object in order to make it easier? So I think this is an open question. Ross, you may have some thoughts. Perhaps others among you might want to comment.
I just would say that asking the questions without the context of having had some type of psychological intervention prior to, I'm not sure that would be all that beneficial, only because the insight maybe isn't there to be able to connect to, is this really something that I'm going to keep or use, or all those are really good questions. But until I got into a room where I was sitting with other people and bringing stuff from home and actually deciding, do I want to discard this, have it recycled, or am I going to keep this? When it was in front of me in that context, it was me to see that it was of more value to me to be able to let go of things.
That's
So
great. Yeah.
I think that's a key piece. Without that context, I think it would be very difficult for the person to be able to have a lot of insight to be able to move forward in that way.
I think some of the books written on hoarding give a list of questions that you can ask yourself, Buried in Treasures, for example,
Oh, yeah.
the clinician guide or the workbook. But which of those questions will matter really does depend on your understanding of why you're saving these things. So that makes great sense. Thanks very much for that.
Gail, can I add one thing?
Yeah, go ahead, Robin.
Yeah, sometimes I really appreciate what you're saying, Ross, and I think sometimes what can be helpful is to kind of do a little test and say, okay, I'm going to pick 5 items in a room and rate my anxiety level. And I'm going to take the item that produces the lowest level of anxiety, and I'm going to put it in the garage as if it's gone. And I'm going to imagine, if this item left, how would I feel? And see if, when you put that item in the garage, to kind of put it aside, are you not sleeping at night thinking about that item being gone? Are you going to regret it? And again, referring to what you said, Gail, about, there's lots of books that have lists of questions you can ask yourself, because I think the idea is that people get caught up in the cognitive distortions about their items. And so doing a little bit of a test to say, okay, I'm going to imagine if this item was gone and I'm going to put it in the garage, I'm going to put it aside. Will I remember that I did that? And oftentimes people will forget and go, oh my gosh, I forgot that I put that there and I haven't used it. I haven't accessed it. I really haven't even thought about it. So I don't know, Ross, if you've ever tried that experience, but sometimes that can be helpful.
Oh yeah, no, that's a really good point. I've actually had stuff in many storage lockers, which ended up getting seized because I was no longer able to pay for them. But in many ways that was a test, because those things were out of my house for a very long period of time. And many of those things I wasn't even aware of what was in the lockers at a certain point. So, but yeah, doing tests to just see what the discomfort level is, for sure, is really helpful.
Thanks very much. I'm going to bounce around among the questions a little bit. Another person is saying that he or she now understands that hoarding is a mental issue and is happy to know that the problem has a name, but is still struggling to accept the problem and that he or she has a mental disorder. And is this normal? And if so, what do I do? If not, what can I do? So is this normal, and what to do? Who wants to take that one?
I can tackle that one or take a stab at it. I think it is a really common phenomenon for folks when they first kind of come to a therapist or some treatment provider, and they get this label. And the label does feel, on one hand, that you're kind of being put into a certain box, and that can feel really challenging. And then also there's this piece with hoarding where you really like your stuff, right? Like it doesn't feel like that's really bad. It's just that some of the things that come along with it, where the hoarding starts to take over and interfere with the way that you would otherwise like to live your life, that it starts to cause problems. And so there's this, again, this tension. And so I think a lot of patients struggle with the label. The one thing that I always say to my patients about the label is that none of these labels are who you are. It is just an aspect. You are way more than that, right? Like it's the same thing if somebody has diabetes. It it is a tool, by labeling it as such, as diabetes, that gives us an avenue for treatments. It gives us an avenue for treatment providers. It gives us a language with which we can pursue getting folks help. And so if you think about it from that perspective, that's all really good. The other piece that I always remind my patients is that these labels are not permanent, right? And so there is something that can happen where you can shift. And just because your medical provider might sometimes use the term hoarding disorder doesn't mean that you have to refer to it that way either. So with a lot of my patients, we come up with our own terms, the clutter issue or my stuff, or whatever you want to call it. And that's really all that matters. So I don't know if anybody else wants to add anything to that.
If I could add a comment, I think thinking about it as a disorder, and as Dr. Champano says, regardless of how you name it, but thinking of it as a disorder rather than who you are, that I think that point I want to emphasize is really important, because especially when somebody's in treatment, making sure that someone is aligned towards thinking like, okay, this is something I'm struggling with. This is a disorder that unfortunately I have, and therefore I have to battle against, rather than feeling like you're fighting yourself, right? And rather than other people around you feeling like they're fighting you, recognize that hopefully that you and they can ally together against a disorder, and gaining some objectivity from it, right? So seeing it as something that you are battling, that's something that you're afflicted with, that you don't want to have anymore, and you'd like to be able to recover from it, is a really important first step in moving towards recovery.
Great. So another question that is coming forward is, how do you address time management issues with people who have hoarding disorder when they get in the way of moving forward with the discarding? Comments? Robin, do you want to?
Yeah. One of the things that I think is really important when you're struggling with clutter or hoarding behaviors is to create a schedule. It's so difficult to let go of stuff. And I think this is for anybody. Have you ever decided I'm going to go clear out my closet, and then you just keep going through one item after another before you realize that you're at the end of the rack and you're like, I didn't get rid of anything. So it really is important to, pull out a schedule, look at your responsibilities, and commit to time that you are willing to discard. And I think maybe even setting a number to say, I'm going to spend an hour 3 times a week and commit to giving up 10 items or 5 items or whatever it is, and to really stick to that, because it is hard once you start to try to make those decisions to talk yourself out of it. I also think it can be helpful to have accountability through a clutter buddy, where you not only schedule a time, but it's kind of like going to the gym. I'm going to meet my friend at the gym, which holds me accountable to have to go. And so if you have a clutter buddy and you say, okay, every Saturday at noon, every Sunday at noon, Saturdays I'll come to your house for an hour, Sundays you'll come to mine, that helps with accountability, because it's really easy to find other things to do in exchange for things that really push you and challenge you. And then the other thing I think is important is to reward yourself. I'm going to spend 1 hour in whatever your schedule is, and then afterwards I'm going to treat myself to a latte, or just giving yourself credit for the hard work that you do.
Thanks. Ross, I wonder if you could comment on this one. What do people suggest for weekly assignments for our group to continue progressing? Right now, we have small goal check-ins and a weekly topic to discuss. Thoughts?
Well, I guess one of the questions I'd have my experience has been with working primarily with the Buried in Treasures book. And I also co-facilitated a Buried in Treasures self-help group. And so I'd want to know whether they're using some reference materials, primarily because it's very well laid out in that book and in the workshops. So to be able to follow along in that context,
Okay.
but there's more activities to be doing.
Right.
Is that
So
I can jump in real quick, if you don't mind, Ross. I just got off the phone with, we ran a group like about 4 years ago, and they were a really tight group. And so I just got off the phone with one of them, and they've continued meeting on their own after they finished working with us. And this has been now going on for 4 years. And so I was asking, like,
oh wow,
what are you doing? Like, this is amazing that you're continuing. And I loved their model, which is that they do gold check-in, but every person at the start of the meeting shares one of their successes that past week, something that they're proud of. And then they share something where they got stuck. And then the group plans and brainstorms around how can we help you get unstuck with that thing. And then that's what they base their next goal on. And they've done this completely independently. And I'm so proud of them. And it's a great model, I think, for how you could keep something like this going, even outside of the context of an official therapy group.
and I think Ross is pointing to the need for activity. You need to find things to do that will move you forward. So, and having the group comment on that seems like an excellent way of moving forward. Okay. Go ahead, Ross, did you have a?
No, I think that's amazing. That, like, to have it in that such a simple way to talk about the successes and the challenges, and to have the group actually support you in moving forward with a plan. I think that's amazing.
So Ross and perhaps others who are more clinically focused can comment. This person is asking about how you relate to objects differently after the support group. And this was specifically directed to Ross. That is, what has changed in your approach to the objects? Can you comment?
I think it largely depends on, for me anyway, it largely depends on the type of object. So for example, in my case, my mother died when I was 28. And that sort of precipitated the beginning of my hoarding journey. And for me, things that are of sentimental value that my mother maybe once owned, or a family member once owned, is much more difficult. But all the other things that I once had almost the same emotional attachment, like an over attachment to even receipts, was almost on the same level as something that belonged to my mother, which intellectually makes no sense.
Mm-hmm.
But at least now I have the ability to, I guess it's more distance, if that makes sense.
Right.
So I have
to figure out priority, perhaps, what matters to you.
Absolutely. So I have more distance from the vast majority of items, and it's much easier for me to do an evaluation and say, really, I can donate this. In fact, I have donated a lot of things and been very, very easy to do that, only because I had help.
Great, thank you. A couple of questions are coming up about medications. So maybe Sanjay, you could comment on these. One was generally if there are any meds that seem to help motivate people to get rid of clutter. And another question came up about whether antipsychotics might ever be useful.
Sure. I think both are important points. When medications do seem to help with hoarding disorder, they do improve motivation. Now, how much of that is because they're just reducing the anxiety that there is or the distress related to discarding, and how much is because they're working also on depressive symptoms, so improving motivation to do anything, and improving interest and energy level, right? I think all of those are important. But medications have multiple different effects, and they differ from one person to another. But the medications that we've found to be effective are either in the antidepressant class, or in the case of atomoxetine or Strattera, a medication that's used for ADHD, but has pretty strong effects on motivation, just as stimulants do. Second part of the question was about antipsychotics. There are no formal studies of antipsychotics for hoarding disorder. There are lots for OCD. And so the group of medications that are called atypical antipsychotics are probably the first or the most effective adjunctive or second line treatments for OCD that add on to primary anti-OCD medications and boost their effects for the large number of people who don't necessarily get a full response to the primary medications. Whether they have that same boosting or augmenting effect for hoarding disorder is unclear. Just in my own clinical practice, I've seen some people who did have good responses that really seemed to be due to the addition of an atypical antipsychotic at a low dose, and then lots of other patients who didn't. So it's without actual data and real studies, it's really hard to know, for example, what percentage of people with hoarding disorder would in fact get a good response to those medications.
Great, thank you. Here's a research question. So perhaps Chiara, you want to comment on this? Is there specific research about the correlation between hoarding disorder and addiction and family issues with addictions? So hoarding and addictions.
There is a little bit of research on this. So there's some emerging studies that do show that maybe there is some form of correlation between different forms of addiction and hoarding. In our own data, that has not panned out. So we have not replicated those findings. And so what we need are larger studies to really be able to investigate this. There's another piece to this, which is that a lot of our research participants are a little bit older adults. And so we have a lifetime. And so one of the things that I think researchers haven't looked at closely enough yet is whether there might have been addiction issues earlier in an individual's lifespan before they are participating in a study. Clinically, I have a lot of patients who will talk about their struggles with the acquiring and with the difficulties discarding almost as an addiction. They're like, I know I should stop this. I really, part of me really wants to, and I just feel like I can't. So it is an interesting question. And one that is definitely something that we need to look closer into.
Okay, thank you. A couple of questions have come up about the language we use in terms of labeling someone who has hoarding or hoarding disorder. And maybe I can be clear that the term hoarding is a broad term. And I think someone was hoping that there might be other terms besides hoarding to use, although I don't think I have a solution to that. But that hoarding refers to saving excessively and being unable to discard the items or get rid of, let go of the items. And hoarding disorder means that it's gotten to a point where it is seriously interfering in a person's life. So those are related, but kind of on a spectrum of symptom and condition. But the question is, how do we refer to people who have hoarding problems? Do we use terms like hoarder? If we use them for ourselves, do we use them for other people, and so forth? Do you all want to comment on that?
I think it's very individualized. I mean, I think one way to look at it is somebody who has diabetes, they might call themselves a diabetic. Other people might just refer to themselves as someone who has diabetes. And I think one way to address this is to ask them, you know, how would you like me to refer to you or your stuff? Because some people, I think, really embrace it as a way, as you were suggesting, Gail, to say, this is something that I'm really struggling with. And then other people take offense to it. And one of the approaches that we find very, very important in the treatment is working with the families and being really clear about how they would like to be referred to personally and in connection to their stuff. So it's so individualized. And Ross, you might comment on that as well, you know, in terms of some of the struggles that you've had and whether or not you've taken offense to that, or you've just been able to say, this is what I struggle with, and, you know, calling a spade a spade.
Ross, go ahead.
Yeah, I can comment briefly just to say that I've suffered from depression almost my entire life, and I don't have any particular, for whatever reason, I don't have any particular shame around having mental health struggles. And so I don't have any reason to look at hoarding any differently. For me, it's a really difficult question. I can understand the difficulty sort of maybe accepting the term. I can see how it could be perceived as being very negative, especially given the context of the television program. That gives a really extreme image of the worst, possibly the worst cases ever. And not all cases are like that. So I think that's difficult, but I also can relate in terms of equating it to any other addiction. And I know that maybe isn't clinically something that people talk about, but I don't have any particular issues around that either. I don't feel that's super helpful for me to get better, to be able to have any particular issues around what it's called per se, if that makes sense.
That's a helpful perspective. Thank you very much. We have a number of questions in the Q&A about family and how to manage the approach to, in one case, we have a 91-year-old father with hoarding who's living with a 53-year-old daughter who is the sister of the person writing in. And the daughter also has a hoarding problem. And the question for her as the sister and the daughter is trying to figure out how to approach this problem so that some kind of management of the hoarding problem could occur. And there are other versions of this question that people have asked. So who wants to tackle that one? Robin, do you want to, or Kiara, it looks like you're ready. Go for it.
Well, I'm happy to I think the earlier version and that was asked related to this for how can family members engage with their loved ones. I don't know, I took the first question. So Robin, if you want to jump in. I think it does again come down to trying to find common ground that folks can agree on. So if it's something like I want to stay living independently in my home, and everybody agrees that that is a good goal to work towards, then the question becomes, well, how can we make that happen? And so how can we make that happen while keeping the individual safe? That they're able to, be healthy, and that the clutter isn't interfering to that degree where it might actually cause some harm. So finding that common language and being able to kind of work around with that. And certainly, having a therapist to help kind of navigate those conversations is really, really helpful. But Robin, I don't know if you want to add anything.
Yeah. I think there's a couple things. One is there is more and more research. Actually, let me correct that. There's more and more self-help books out there that are giving a lot of really good information. And going back to what you referenced earlier, Kiara, is the harm reduction model and looking at safety and things like that. And then the comment that I was going to make was, as you mentioned also, Kira, was just the possibility of looking at going and seeing a therapist and talking to someone. And a lot of people are resistant to that because they're immediately thinking, well, you're just going to make me get rid of my stuff. And I think it's important to remember that there is a lot of legwork that happens, and you touched on this, Ross, before you even get to that place where you're ready to get rid of your stuff. And so, I think probably more people call me that are not struggling with hoarding behaviors, neighbors, friends, loved ones who say, what can I do to help this person? And one of the things that I say is, of course, depending on where they're calling from, I refer them to the IOCDF provider database to see if there might be someone locally who can help them. And if not locally, in their state, because with Zoom now, it really has opened the door to a lot of access that people might not have had otherwise to providers. But the second thing that I tell them is it's important to remember that going to a therapist is something that's voluntary. And if you go and it doesn't work for you, then you've given it a try. But tell your loved one or your friend that they can see this as an informational session, that you're not going to because you're committing to something, you're not going because they're going to try to find ways to, make you get rid of your stuff. As it is, they might have some information that might be helpful to guide and direct you as to how you might be able to make your home a little more manageable and safe.
Thanks. So this one I think is directed at Kiara and Sanjay. My clutter started with trauma, violence, and the threat of violence. Are there specific ways that I need to get help with the decluttering process?
Yeah, that's a really common thing that we see, and that has also been borne out in the research that individuals can kind of, if not recognize that their difficulties started after a traumatic event, that it sort of started to trickle and grow and grow and grow after some sort of stressful life event. And that can really range from traumatic, as you said, violence to the person, or it can also take the form of loss. That is something that we hear a lot, which is just individuals who experience interpersonal loss, and that they then start to feel more comfort by objects, and then it just starts to grow and grow and get out of hand. With regard to treatment, as of right now, it looks like we would use the same treatments that we would use for individuals who don't report a stressful life event or trauma. So that is from the research perspective. The treatments are designed to be flexible, to be able to adapt to each individual's issues, that they're kind of the reasons why they save and what that means for them and their life. And so it should be able to adapt pretty flexibly. And that would be something to explore with your therapist then, if there's additional treatment that might be warranted. If, for example, the patient also meets for a diagnosis of post-traumatic stress disorder, that would be then an issue where we might want to do treatment for the hoarding, but then also pursue treatment for the PTSD.
Okay. All right. Sanjay, did you have anything to add, or?
Yeah, a couple of things. I think this question comes up a lot, and I think it's true for many disorders that the tendency often amongst clinicians and amongst people with the disorders and their families is always to attribute the current behavior to some trauma. And that's just because that's been historically the way a lot of people thought about things. But all of us have done research on this area, and many others have done research in this area. And while trauma is an important factor, it's rarely what starts the disorder, right? Because as we've seen, most of the studies that looked at actual onset of hoarding and saving symptoms, difficulty discarding, and so on, show that those start in childhood and usually, early teens, 12, 13, 14 years old. And then they get worse with trauma. But that's true for lots of disorders, right? So trauma is a pretty non-specific risk factor for a whole bunch of different neuropsychiatric disorders. It's risk factor for certainly for PTSD, but also for many other anxiety disorders. It's even a risk factor for OCD and for depression, as well as for hoarding. And so trying to find the, kind of the aha moment in somebody's life when, well, this is where everything started. It's usually really just where things got worse, not really where they started. And so, yeah, so while it's important to deal with traumas, of course, because they have huge impacts and cause tremendous impairment and distress, you still have to deal with the hoarding also. And I think that's something that Kira was pointing out.
So another question coming up is, what questions should we ask a therapist to make sure that they can actually help us? And I wonder, Ross, you may have thoughts about this yourself, but Robin, other thoughts?
Yeah, I can jump in, and then Ross, you can piggyback. I think it is so important that anybody who's looking for therapy for any condition to vet the therapist. If you go on even like Psychology Today, you'll see that people have listed 20 different types of therapy that they do that is so widely diverse. And I'm thinking, how can somebody be good at so many different things versus looking at someone's profile where you show that they do OCD and social anxiety and hoarding disorder and that sort of thing, where you see a continuum of someone who's specializing in the treatment of anxiety disorders. But I don't feel there is anything wrong with asking somebody, where did you get your training in treating hoarding behaviors or hoarding disorder? Because taking a weekend workshop is not something that I would consider someone to be an expert. That have they really received specialized training? What methodologies do they use specifically in the treatment of hoarding behavior? I think on top of that, if you do recognize that you have some very specific precursors to when the hoarding behavior started, is that person also equipped to be able to handle those? Because I know for myself, there are some forms of trauma that I don't have specialization in. And so if somebody comes to me and they say, I'm able to identify that when this happened, I started to have problems with clutter or hoarding behaviors, then I would say to them, I don't have training or expertise in this particular area, and I think it might be important to explore that first, and then let's then loop back and see where you're at, and then we could do some work together. So that's just my thought, and again, just bringing it home, I think it's important to vet them and find out what their training looks like.
Ross, did you have any comment?
I can't really say anything specific. I'm not sure if they're wanting to know what questions they should ask pertaining to their situation of hoarding specifically. For me, it would be around being able to treat hoarding disorder at the same time as unresolved grief. So that's my case.
I see. Mm-hmm.
It might not be the same for everyone. So that's about as much as I can say.
I think what you're pointing to is that hoarding is often accompanied by other conditions, and you've mentioned depression, trauma has been mentioned. So part of the issue is, what is the person's own experience with it and comorbid problems, and who can best help with that. So thanks, Robin, as well on that one. Here's a question coming in. We've talked about getting rid of stuff. Are there any tactics for keeping it out of the home in the first place? So non-acquiring. Who would like to talk about that? Kiara.
Yeah, I'm happy to take a first stab at that. I mean, it is so critical. We can work on discarding all day long, and if the objects are coming in quicker than you can discard them, you're going to make absolutely zero progress. So non-acquiring or just basic tactics for how to deal with acquiring behaviors is absolutely critical. And the part that I really always want to emphasize is that it goes both ways, right? Because some of our patients, in part because things have gotten so serious to the financial impact of this, that they will avoid exposure to all potential places where they might acquire things. And that's no way to live a life either. And so whether it is active acquiring, whether it is passive acquiring, and whether it is this extreme avoidance behavior, all of that needs to be addressed. In therapy, we do a lot of, we use similar techniques to the discarding practices where, you might go to a shop that is, and we'll start with something that's not super tempting, but a little bit tempting. And then we're gonna prepare by asking questions so that it is more of a transition from just acquiring to more mindful acquiring of, do I really need this item? Is this really something that should come into my home? Do I already have it? All sorts of different questions that we can ask to try to create that shift. So, and then we'll work our way up to more and more tempting types of experiences. So.
This sort of piggybacks on another of the questions we've spoken about, where we mentioned the comorbidities of it. Any suggestions about approaching therapy with multiple comorbidities? Often therapists want to start with one thing, and yet everything is so interrelated. Where do I start is the idea here. Thoughts, Robin, I suspect, and Sanjay, you may have thoughts. Yeah, Sanjay, go ahead.
I can address this. I would say most of the people I see in a clinical setting have multiple disorders. And I work currently in an intensive treatment program. And so multiple severe disorders that are really complex and are interacting are the norm, not the exception. So we run across this question every single day, right? Whether it's someone who has a combination of multiple anxiety disorders and PTSD and a substance abuse history and a mood disorder, right? And one of those could include hoarding disorder. So the question is, once you do an assessment, number one, it's really important to get all the history and spend enough time as a clinical team to really figure out exactly all the different problems that a person is suffering from and what their chronology is and how they do interrelate. And that takes some time to do. It's not going to always be possible just at, an initial intakes that takes 1 hour. Once we kind of go through that and we can kind of describe and enumerate the different conditions that a person appears to be suffering from or has had in their history. One of the first questions I often ask people is, okay, among these 4 or 5 different things that we've identified and we've described, what's the most distressing for you? What do you want to work on the most? What's causing the most impairment and havoc in your life? Now, their answer might not exactly agree with what you as a clinician thought, but usually it does. And usually what the person is identifying is what they are most motivated to work on. So even if somebody else might say, yeah, you know what, that's maybe only 3rd most important or 4th most important. If it's the one that right now they are most highly motivated to work on, especially in a cognitive behavioral therapy that's going to require lots of effort and lots of time and lots of energy, then it's worth it to start there. If there's a clear, distinction between what disorder and what set of problems are really messing up somebody's life, causing health and safety hazards in the home, for example, causing suicidality or risk to self or risk to other people, then those have to jump to the highest part of the priority list. And therapists and clinicians will often focus on those because they're the most pressing and they're the most urgent. And they have to be dealt with right away because otherwise you won't be able to make progress on anything else. I think there are certain disorders that interfere with the treatment of the other things that are going on, right? So when someone has pretty severe depression, let's say, it's going to be hard to make progress on the hoarding or on the OCD or on the panic disorder until you actually get the person out of bed and treat their severe depression until they have the mental energy, the physical energy, and the motivation and interest to be able to work on the other disorders. Another one that frequently interferes is substance abuse, right? It's going to be, again, hard to treat and focus on things like hoarding disorder or depression or anxiety problems when the person is actively using a substance. That's going to, interfere with medications treatment. It's going to interfere with the effectiveness of cognitive behavioral therapy as well. So sometimes what we as clinicians will pick to focus on first are the ones that are interfering the most with the others. So it's a really complicated question, and it's a different answer for each individual because it really depends on what's going on in that person's life and their circumstances.
Great. Thank you. A question is coming in from Lee Schuer. Hi, Lee. We know Lee as a very strong peer support trainer who has led many BIT workshops. Is there work being done to reach and help children? Who would like to comment on that? Robin, did you? Oh, Kiara, I see you commenting. Okay, go ahead.
Yeah, I think that this would be another topic for where we need more teams doing more research pronto. So there's a few labs that are starting to look at it, and I think that there are a number of issues. The first is that it is a little bit, we don't understand the phenomenon of hoarding in kids as well as we understand the phenomenon of hoarding in adults and older adults specifically. And so one of the big questions, so as Dr. Saxena pointed out, a lot of the patients will say, this really started when I was in my teens, early, young adulthood, basically. And so there are two things that we need to understand. First is, for the majority of patients, where does that transition happen of where it really starts to crystallize and become an issue? And then, of course, there's, again, that whole lifespan that happens before individuals most frequently seek therapy. And so understanding what is happening along that span is something that there's some research going on in that by my group and a couple of collaborators. The question about hoarding in children, the first question is it actually hoarding associated with hoarding disorder, or is it hoarding associated with some other condition like autism or OCD? And so those questions matter because, of course, treatments will differ then subsequently. So is there research being done? Yes, we need more of it. There are more questions than we have answers right now, but hopefully more and more teams are going to turn to that.
Okay. I certainly agree with that. We just don't have enough information about its development early in a child's life versus development in that later teen, early adulthood period, and what it is that actually occurs. I have another question that's coming here on what training could we expect therapists or clinicians to have taken about hoarding disorder before they treat someone. So I think my own reaction to that is that if you're going to enter into treatment with a clinician, then always ask the question, what training do they have in the problem that you're bringing to them? And listen closely and see what they say. It doesn't mean that you cannot start with a person who has very limited training, so long as they are anxious to go out, interested in going out, to learn whatever they can about it. And then, but the two of you will be learning together about how to treat the problem. But I think for some people, finding a clinician in the local area that has a lot of training may be quite difficult for you. Keep in mind now that there are now opportunities following the pandemic for treatment across state lines, for virtual treatment. Not necessarily the best strategy for hoarding because it means that going into the home is hard. But on the other hand, we do have web camera options now that we never had before. So using Zoom and other mechanisms for treatment is a possibility. But do any of you have other comments about the training that you think someone might ask about?
My initial thought, just in everything that you said, Gail, I totally agree with, because trying to find somebody who is considered to be an expert can be difficult. And that's an interesting question too, because I have a lot of people that will say, you know, why aren't there more people out there? And I don't know that I have the answer to that, but thanks be to the IOCDF and all the work that they're doing, and all the research that's going out there to help us better understand, you know, what leads to the problem. I think we're gaining some speed over time. But I also think that it is helpful for someone to have training in cognitive behavioral therapy so that individuals can learn the factors that are leading to the acquisition and the difficulty letting go, and then the idea of exposure and response prevention, and that is being willing to be brave, if you will, and start letting go of the stuff and testing your fear to see if what you fear is going to happen. So that's where the cognitive distortions or the thinking errors come in with respect to, I'm always going to regret it. I'll never be able to forget about it, or my aunt, God rest her soul in heaven, will never forgive me. So just being aware of those things that lead to the difficulty of letting go. So CBT and ERP, I think mindfulness is very important, and also acceptance and commitment therapy can be very helpful as well. And I think motivational interviewing too, when people are really struggling with the process.
Okay. All right, we're continuing to get a number of questions that involve family matters. And let me see if I can track down the one that I was going to put to you. I'm coming to terms with my parents who are in their 70s and 80s who have hoarding disorder and home safety issues. Would it help if other peer-aged relatives that my parents trust also approach and talk to them about the issue? The problem I face as their daughter is that I might trigger resistance and denial. Would it be violating their privacy to speak to the other relatives to invite their help? She's struggling with her love and obligation as a daughter. By the way, one of the issues that has come up in multiple ones is that there are resources out there for family members, and in particular, digging out a book by Michael Tompkins and Tamara Hartle may be helpful. I think I put that in a reply that went out to everyone. And there are undoubtedly some other resources. But do you want to comment about this privacy issue? And Ross, you may have views on this based on your experience with the peers you've worked with. Robin or Chiara or Sanjay, any comments?
From a personal standpoint, I think that's exceedingly difficult. I can totally empathize with the daughter's position, but at the same time, I can understand how I maybe would not receive it in the same way, but that's maybe not true of everyone. That a family member might somehow be apprised of the situation and then asked to get involved. I can sense that could be particularly difficult and possibly harmful to the parents. But again, you're wanting to try and help the situation. So I totally empathize with where she's coming from. And maybe in certain situations, it might turn out okay. And others maybe not.
Right. So perhaps the daughter could seek some advice if she has a sibling or a cousin or someone else who knows her parents and might be able to comment. It is a privacy issue. It's complicated. I think, Ross, you kind of laid that out pretty clearly. Okay, there was a question in here I'm struggling to find that was about the usefulness of mindfulness and other mental strategies to improve the ability to let go of objects. So does anybody want to comment about that? Robin, you made reference to this.
Yeah, I think what is really important in
Oh,
this,
I found it. Let me just be clear. Let me read
Okay.
it if I can, and then you can chime in. What's the relationship between mindfulness, meditation, and mindful movement practices like Qigong and yoga to help people with their anxiety levels that prevent them from being able to examine the hoarding and take action? Does calming the mind with awareness and movement help? So that's both a research and a clinical question.
Yeah, so I can speak to some of it. Some of those terms I'm not particularly familiar with, but just in terms of the concept of mindfulness, I think it is so important because when you're feeling anxious and when you're feeling fearful and you're having to let go of stuff, there's so much catastrophizing that can be going on, and a person gets so stuck in their head about all the feared things that are going to happen. So I think that that's where the mindfulness of bringing yourself back and trying to be in the moment and trying to be grounded and present is really important. And I think that that's also where the acceptance and commitment therapy can be very helpful too, is learning how to better tolerate the feelings that are coming up. But I'm going to defer at this point because I have limited information about other parts of the question.
Any other thoughts? Robin? No, Kiara, sorry.
Yeah, there's no research as of right now to look at whether we could use mindfulness-based approaches as an effective treatment for hoarding disorder. And the one thing I will say from my own clinical, so we have a mindfulness institute at the University of Miami, and so we've actually gotten a few of our patients through kind of a dual avenue. And so for some individuals, adding mindfulness to kind of a classic cognitive behavioral therapy approach to hoarding, to treat hoarding, has been really, really helpful. And just like anything, for some individuals, they just, the mindfulness really doesn't do it for them. So I think that the research hasn't been done yet. It might be helpful if you personally find mindfulness to be, an aid in how you kind of approach life and think through things. It can absolutely be a really great adjunct to add in for how you engage both discarding as well as non-acquiring.
Thank you. Go
Add,
ahead, Sanjay.
Just a quick thing. So there has been some research on mindfulness as well as ACT as kind of add-on treatments for cognitive behavioral therapy for OCD. And one thing that I think it's really important to find to remember is that they're add-on treatments. They're not a substitute for the actual cognitive behavioral therapy. There are a lot of clinicians out there who will try to treat OCD or hoarding disorder with just mindfulness or just ACT, and it really doesn't work. Because they're not getting the part of the treatment that's really necessary, which is the cognitive behavioral therapy. But as an adjunct, yeah, it can be helpful.
Okay, great. We have only a few minutes left, actually 2 or 3. And here's one that anyone can take. What can people with hoarding disorder do if they're truly motivated to make changes but can't access the recommended resources like support groups or a clinician? What should they do? This is a complicated answer, but be brief.
Yeah. I mean, I would just say then maybe looking at self-help books, Buried in Treasures. That's just my initial thought, but to the others.
Right. We do know that reading those books actually does help less than 10% of people, but it does help those people. So,
and
Ross?
I would just briefly say, if you have if there is any supportive people any supportive people in your life, whether that be a partner in the home, friends, family, that you're able to talk to. I know it's a difficult problem, but if there are people that you can ask for help, and in my case, I'm realizing that I actually still need to do that because I don't have currently any resources outside of the home. So I would say find anybody that is not going to be judgmental, that will be able to support you in moving forward in small pieces.
I'm going to highlight that. I think, Ross, that's an excellent answer. Look for help wherever you can find it. Think about your church, any groups of people that you're involved with, neighbors, friends, you know, teenagers on the block, whatever occurs to you that might make sense. All right, we are now out of time. And so many of your questions remain a bit unanswered, although I think we've touched on the bulk of them. And we very much appreciate everybody's signing on. And thank you so much, panelists, Dr. Saxena, Dr. Zazio, Timpano, and Ross Bartleman. Thank you very much for your time.